Hello.
My name is Andrea and I'm a student nurse.
Oh, hi, nice to meet you. My name is Joe.
Is it okay if I follow you around today?
Yeah, that'd be great.
Would you mind giving me an SBAR on your patient?
Sure. My patient is Shanana O'Connor, and she's in room 321. She's 34 years old and she's a female. She has allergy to trimethoprim sulfamethoxazole, and she's full code, and she's admitted by Dr. Englehart. She's 177 pounds and she's 5'9". Her BMI is 26.1. Her primary diagnosis is a fever of undetermined origin, and her secondary diagnosis is end-stage renal disease. And she's been type 1 diabetes since age 8. That's when she was diagnosed. And she was also diagnosed with end-stage renal disease a year ago. And she has a history of recurrent UTI, and that's what we think may be the cause of her fever. Recent pain score was 4. She denies a change in vision, hearing, and reports numbness and tingling in her lower legs. Mild diaphoresis, functioning AV graft is clean, intact with thrill, and bruit present. The cap refill is less than 4 seconds. She has positive for Perla, and her sensations are diminished in her lower legs. She denies shortness of breath, denies recent colds, reports quitting smoking 2 years ago, and then all of her lobes in her lungs are clear to auscultation. She denies chest pain or palpitations. She reports elevated blood glucose over the past few days, and the normal dose of her medication controlling the glucose is not controlling it well. Tachycardia, she has tachycardia. Her S1 and S2 signs are present with no murmur noted. Non-pitting edema in lower extremities, and 1+ pedal pulse in both feet. The non-pitting edema is 1+ as well. She has renal disease diet with 1,500 milliliter fluid restriction. She reports weight gain of 10 pounds over the last few weeks, decrease in appetite, decrease intake. It denies abdominal pain, denies change in bowel habits. Her abdomen is soft, round, and non-tender, and bowel sounds are present in all 4 quadrants. Her intake and output is being recorded. Her intake was 375 milliliters, and her output was 200 milliliters. She reports a decrease in frequency and volume of her urination, and it's darker, more concentrated urine. She denies pain, burning, or difficulty urinating, and with no bladder distension. Her vital signs were taken at 7:30 with a 101.1 temperature, so she's running a fever. Her heart rate's 95, with her pulse ox being 96, and her blood pressure is 138/78. We're still waiting to get a culture back for, but her urinalysis is cloudy, amber colored, and her white blood cell count is raised. And say she's going to be receiving the impenem and the cystatin, IV piggyback, and then she's going to have a continuous infusion of sodium chloride, 0.9%.
Why specifically is this client receiving this medication?
She's receiving it because we have reason to believe that she has a urinary tract infection. She has an infection. So she's receiving this anti-infective medication to reduce the symptoms of her infection and fight it off. Yep.
What action does this medication have on the body?
The impenem attacks the cell wall of the bacteria, and then the cystatin keeps it from being eliminated by her kidneys.
When should you question administering this medication?
If she has any history of sensitivity or hypersensitivity, allergic reaction to the medications, or also there's a cross-sensitivity for penicillins and cephalosporins, that also. And then also you want to look at her kidney function, and if she has a poor kidney function, you want to make sure the dose is a safe level for her kidneys. And also, yeah, that's the main ones.
Does this medication have a therapeutic serum level?
No, it does not.
Which vital signs do you need to monitor?
We want to check all vital signs, but for her specifically, we don't want to check her blood pressure, because she usually has hypertension, her blood glucose levels, because she's a diabetic, and Usually those are quite high. And then also you want to check her temperature since she's been running temperature lately.
Which physiological parameters do you need to monitor when this medication is being administered?
You then want to take a look for signs of anaphylaxis, like rash, laryngeal edema, or asthma. You then want to take a look at her urine, since we think it's a UTI. I want to look at the characteristics of it, things like that.
What interventions must be taught to a client to ensure that the medication is administered safely in the hospital?
Well, you don't want to tell I want to keep standard precautions when setting up the IV, standard procedures. I want to make sure my hands are clean, wash my hands, put on gloves. I want to check the line, make sure there's no bubbles in it before administering it. I want to keep all the ports clean and the connections clean by keeping them capped and also using the alcohol swab on them. You then want to keep an eye out for different IV complications such as infiltration or phlebitis, so look for redness and ask for pain frequently. You then want to check the medication for any rips, tears, leakages, also for how it appears, if it's cloudy, or the expiration date. Check that on that. And just make sure they know to follow the doctor's orders for the flow rate and for when to receive the medication, and the mixture as well, because you don't want to mix it with a normal saline.
What interventions must be taught for taking this medication safely at home?
It's going to be very similar. They just have more responsibility to make sure everything's in place, like following standard procedures, following the doctor's orders, and also keeping the home health nurse, make sure that they know what the doctor's orders are as well.
What are the side effects and potential adverse reactions?
So nausea, vomiting, diarrhea. The diarrhea, because it's a broad spectrum antibiotic, because it's kind of undetermined for sure what the bacteria is. So it's going to kill a lot of her normal flora, which could open up a possibility for having a C. diff infection. So really don't want her to watch out for diarrhea especially and report it to us if she's experiencing that.
How will you know if this medication is effective?
You know it's effective when all her signs and symptoms of having an infection, such as her fever, and her labs come back as her not having an infection anymore.
Thanks.
Yeah, no problem. So I'm going to be going to the patient's room and administering the medication if you'd like to come along.
Sure, that'd be great.
Awesome. So I'm just opening up my chart right here. Okay. So we have Shanann O'Connor, and she has the allergy to trimethoprim sulfamethoxazole. It's a sulfa drug. Open up the MAR. Alright, so now that we looked at her name and there are allergies in the chart, let's go meet her. We'll wash our hands. And then give her a knock right now. Hello.
Hello.
Hi, I'm Joe. I'm going to be your nurse today,
Okay, cool.
and I'm going to be setting up your antibiotic.
All right.
Alright. And what's your name?
Shanann O'Connor,
And how old are you? Shanann?
34.
Awesome. And do you have any allergies?
I do to trimethoprim sulfamethoxazole.
Oh, awesome. Thank you. So I checked your allergies and the right patient. So now we're going to take a look at the medication she's going to be receiving. She's going to get the impenem and cilistatin injection, and then she's also going to get the sodium chloride, and that's a continuous infusion. So I'll start with that. So here we have our normal saline, and it's going to be 30 milliliters an hour, and that's going to be continuous. And the start is at 0630, and It's it's 7:36, so I have to hurry to get this. So it's sodium chloride, 30 milliliters an hour. It's gonna be intravenously, and it's for Shanana O'Connor. And let me just set this up. And before I hook this up, I'm going to double check and look at the doctor's orders as well as the MAR, just to compare the two, make sure everything's good. And yep, everything's correct. How are you doing today, Shanana?
I'm good. How are you?
I'm doing great. So we got our tubing. And checking the expiration date. Sun expires 3/25. And then just make sure everything's clamped. So we want to fill the chamber. And before I set this up, I'm going to scan it. Something else up. Alrighty. So I'll just scan this. Beep. And what is your ID number?
842-334-3660.
And then I'm just going to double check that. Scanner's not working, so I had to enter this manually. I'm sorry, what's your number one more time?
842-334-3660.
Alrighty, Shannon O'Connor. And so I'm just going to double check, and it's sodium chloride, and it's going to be infusing at 30 milliliters an hour, and it's at at the right time. It's supposed to be given at 6:30 and 7:30, and it's for Shanann O'Connor, and it's going to be given intravenously. And then I'll have you check for the flow rate, so nurse, so you can,
Sure.
Andrea. Thank you. So it's round 2. Bubbles get out. Thank you. So I'll check the tubing for any bubbles. And it all looks clear. Awesome. So I'm using a dial flow today, so I'm gonna make sure I flush that. So that's all flush, and yep, this flush is normal saline and expiration date on that's good. So now, Shanann, I'm not to flush your IV site.
Okay.
You have your right arm?
Mm-hmm.
All right. So I'll flush that. Thank you. And it's pain. And then I connect the dial. And then make sure it's clamped after I flush it. Thank you. So connect the dial flow. And this is going at a rate of 30 milliliters an hour. So I'll set that at 30. And then could you come and check this?
30.
Awesome. Great. And then I'll just that flow. Awesome. So now we'll get your antibiotic hooked up.
Okay.
Okay. So for this one we have the impanum, and we have the green light now as well. So now we have the impanum and cilistatin. And this one's going at 500 milligrams and 100 milliliters over an hour. And that's going over 8 hours. And that's be given at 6:30. And it's going to be IV piggyback for Shanann O'Connor. And looks sealed. And the expiration date's 3/25. And before that, I'm just going to check with the drug book and make sure that it can be mixed with normal saline and it can, and it's a proper dose for this patient. And it is. So first I'm going to lower the normal saline. How are you doing, Shanana? Do you have any pain or?
No, I'm feeling good.
Okay,
Ready to fight this infection.
that's the spirit. Alright, so that lowered. And then I'll check one more time. It's going to be the impenem psilocybin, and that's given over 1 hour. It's given 100 milliliters an hour. And it's intravenous, and IV piggyback, and it's for Shania O'Connor, and it's to be given at 6:30, which is the right time. Make sure it's clamped. Prime it. First, I'm going to make sure I get the green light on that before I prime it. So, what is your ID again?
842 334 436 60.
I'm sorry, you just tell me that one more time.
842 334 3660.
Okay, thank you. Just not. Alright, so the green light on that. Could you hold the bucket for me?
Yeah.
So I'm going to prime it. Comes out quick. I'm going to check for any air bubbles. It doesn't look like there's any. So I'm going to set this right here. And I want to alcohol swab it. 100 milliliters an hour? Yes, that's correct. So we'll set this to 100 milliliters an hour. Alright. And I'll clamp it. Oh, could you check for real quick, Andrea? It's 100 milliliters an hour.
100.
Alright, thank you. Alright, I'll clamp it. Alright, so let's leave that infusing for you. So, Shanana, before I leave, I want to do some teaching for you.
Okay.
That's alright.
Yeah.
So, you're going to be receiving the Implan psilocybin. Do you know some of the side effects that could occur for that?
Nausea,
What?
diarrhea, maybe.
Yeah, it's nausea and diarrhea. Exactly. It's very good. And also, you'll want to watch out for if you're out in the sun, not to get too much sun exposure,
Okay.
things like that. Also, you want to make sure you don't share your medication with anybody else. And yeah, I'll also give you this handout about your medication so you can look over it.
Okay. Thank you.
And you're not feeling any pain or anything?
No, I feel fine.
Alright, awesome. Thank you.
Thank you.
So make sure to wash your hands before you leave. And lower your bed, and here's your call light. So if you need anything, just let me know.
Thank you.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I checked her allergies to make sure she's not allergic to the medication or anything that'd be cross-sensitivity. I checked her vital signs and some of the reasons why we might be administering the medication, and she does have signs of infection, so it would be proper to give her this medication.
Did this information affect your decision to administer the medication?
Yes, because it helped me determine that it'd be safe to administer the medication to the patient, and also for effective for why she's in the hospital, it'd be effective to treat her.
Did this information affect how you administered the medication?
Yes. Actually, no, because I would normally follow standard procedures for setting up an IV. And I'm just going to do some charting of what I did today. And thanks for coming along.
Thank you.